three things. We're going to be talking about what we mean by the word health. We're going to be describing some of the different causes of ill health. We're going to explain how health problems can interact as well, so how we can take people with multiple different problems and how they interact to cause different problems for them. So the first thing I want you to do is in the comments, I want to see whether you can answer this question. If you had to define the word, what would you say? How would you define the word health? And as I've said on the slide there, do feel free to use Google, but try to put it into your own words if you do that. How would you define that word health? Post in the comments for me. Mohammed's gone for the well-being of a person. That sounds pretty good. Jamie, friend, a person's mental or physical. That's very good. Being free from illness or injury, Curtis says. I like the being free from illness. Definitely, that's great. Your physical and mental well-being, says Fatima. Yeah, we've got some good answers here. Good. So I think we have a pretty decent idea to get us going with what we mean by the word health, the state of the body and the brain. That's good. Okay, so we've got some good answers. Let's move on and we'll see what's going on. It'd be a good idea if you had a pen and a piece of paper to hand or your exercise book, just in case you want to make any notes as we go through. But any questions you have or any answers that I ask you to put, just put in the comment section here. So let's move onwards then. So when we're talking about health, we mean three different things. Good physical well, so a lot of you have talked about well-being in your answers there, and there are two aspects to that. There's your physical aspect of well-being and there's your mental aspect. So by physical we mean to do with your body. Is your body well? And by mental well-being we mean, is your mind well? How are you doing mentally? So the absence of disease, good physical well-being, good mental well-being. We often on at the moment around the world, and the reason why we're doing this lesson in this way means that we're probably not taking these things so much for granted as we would do normally. So my first big question then for you for this lesson, I'm going to give you a minute to have a think about it and to post some answers in the comments, is this. Thinking about those three things above, so the absence of disease, good physical well-being and good mental well-being, what could cause you to potentially suffer from poor health? What kinds of things might cause you to suffer from poor health? Give you a minute, post some ideas in the comments, and I'll read out the ones that I think are the best. Fantastic. Juanita's straight in there with stress. Stress is definitely related. Reggie says drugs. Yep, drugs can absolutely affect both your physical and mental well-being. Depression, disease. Evelina says eating unhealthy. That's very good. Oh, guys, the answers are pouring in. This is fantastic. Well done. Rashid says diet and sleep deprivation. That's a good point, Rashid. Yeah, you need to get a good amount of sleep. Aisha says smoking, alcohol and diet. Fantastic. Isha says your surroundings, like viruses being spread. Lots of people saying stress, depression. Silas has taken my list of three things and has said presence of disease, bad physical well-being and bad mental well-being. Very good, Silas, but we're looking for some of the things that cause those. So great, we've got some fantastic answers coming up in the comments. This is great. Alessandra says not enough exercise. That's one that hasn't been talked about before. Oh, Junaid's got an interesting one. Junaid says peer pressure. Junaid, would you mind posting in the comments, what do you think peer pressure, which one of those things would affect what would peer pressure affect, whether you have a disease, your physical well-being or your mental well-being? That's an interesting one, though, peer pressure. Yeah, that's it. Yeah, so Junaid says that peer pressure can affect your mental well-being, and I think she's probably right there. You can be under pressure to be a certain way or perform a certain way, and yeah, that can definitely affect your mental well-being. A good answer there, Junaid. So let's move onwards then. I want to go through some of the things that can cause you ill health. We'll start off with the first thing on our list. We had those listed three things. We talked about the absence of disease, good physical well-being and good mental well-being. Let's start off by looking at disease. And as you are aware, disease is definitely something that is part of everyday life at the moment. And it's unfortunately just a fact of life for the time being. We're under lockdown for at least another few weeks. So we all know quite a bit about disease at the moment. So I'm hoping everyone should be able to do this. Can you list some diseases for me and what causes each of them? And what I want you to do, if you're feeling really clever about this, you might be able to put these into two different categories. You might be able to categorize your diseases in two different ways, and I'll leave it up to you to how you might categorize your lists of diseases. Give you a minute or so, post some answers in the comments, and we'll see what we come up with. Wow, so the lists are coming thick and fast. This is great. You guys have some good ideas here. Rashid's gone for polio. Quite a few people saying corona or coronavirus. What I would say, coronavirus is not a disease. So we need to be clear on that. Coronavirus itself is not a disease, but coronavirus does cause disease. So the answer to the second question, what causes disease, could be coronavirus. But the disease itself, in that particular case, would be called COVID-19. The COVID stands for coronavirus disease. COVID-19, and the 19 was the year that it was first discovered, 2019. So coronavirus disease is the disease, COVID, and what causes it is coronavirus. Heart disease we've got here. Diabetes, yes, very good. Now, Silas has come up with a good thing here. He's talking about communicable and non-communicable. So Silas has got a couple of different categories that he's talking about here. Some of them being communicable, some of them being non-communicable. Bear with me just 1 second. So yeah, so we have two different categories of disease that we can talk about, as Silas has said. We have communicable and we have non-communicable. A lot of people posting stuff here are posting things that I would consider to be communicable diseases. Some people are posting some things I would consider to be non-communicable. Coronary heart disease, for instance, would be a good example of that. Coronavirus, though, would be a good example of something that is communicable. Right, okay, we've got so many great examples of disease going on here. Silas has posted quite a good one. I'm going to see if I can pronounce it. He's gone for pneumono-ultra microscopical silica ovolcanoconiosis. Never heard of it, Silas, but it sounds horrible. Okay, right, cool. So yeah, so we've got some pretty good ideas then about different types of disease. And as we said, we can put them into two main groups. We have communicable diseases, and that word communicable means infectious. If you can communicate it to someone else, then it would count as an infectious or a communicable disease. So that word communicable is quite a long word. It's 5 syllables long, but it has the same root as the word communication. When you are communicating with someone, you're giving them knowledge, you're passing knowledge onto them, you're passing information or whatever it might be onto them. So a communicable disease is a disease that can be communicated, a disease that can be passed on to someone else. They're caused by something called pathogens. Pathogens is a fancy word for things like bacteria and viruses. So, for instance, COVID-19, the disease COVID-19 that we've had so much in the news recently, is caused by a virus. It's caused by a coronavirus, and the disease is called COVID-19. And the clue is in the name, communicable, meaning that it can be passed from one person to another. Non-communicable diseases is our other category. Those are things that are caused by somebody's lifestyle, generally speaking. So we had people talking earlier on about bad diet, stress, and those kinds of things. Those are parts of your life that might be causing you to end up with some kind of disease. You can't pass a non-communicable disease on to someone else. If you were to get a disease like, for instance, I don't know, lung cancer, something like that, that's not contagious. It's not something that you can pass to someone else. It's not something you can communicate to someone else. It is a non-communicable disease. So we can have poor health. Remember, we're talking today about health. Poor health can be caused by communicable and non-communicable diseases. Let's see if we can get some lists going. I want a list on the, and I want you to see if you can do this on a piece of paper. If you have a piece of paper and a pen there, and you can post it, or you can just write it directly into the comments if you want. I want a list first of all of communicable diseases, and those are the ones that you can get from someone else. Let's see what ideas we get in the comments, concentrating just on communicable diseases, just those ones that can be passed from person to person. Silas says, are genetic diseases non-communicable? Yes, we would consider those to be non-communicable. Great, so the ideas are coming in. We've got Princess says Ebola. Yep, Ebola definitely is a communicable disease. That's caused by a virus. Aaliyah says flu. Kajani says fluenza. It's influenza, Kajani. There's an IN on the front of that, but otherwise, yes, a very good answer. Princess says STDs. Yes, that's great. Princess, do you know what STD stands for? If you do, can you post that in the comments, and then we'll talk about that a little bit further. Elizabeth says measles. Very good example. Very good. Flu again. So Gabrielis is talking about inherited stuff. We're not currently going to be talking about inherited. We're talking about things that you can catch from somebody you sit next to on the bus, for instance, rather than inheriting from your grandparents. Ruby, keep your microphone muted, please, Ruby. HIV, very good. HIV is the virus, Elizabeth. That's what's it stand for? Human immunovirus, I think it is. But it causes the disease called AIDS. Autoimmune deficiency syndrome. COVID-19 says Easter, chickenpox, cowpox. Great. So we got some really good ideas. Some really good things coming in here. Yeah. So some people mentioning STDs. Veer has told me what STD stands for. It's sexually transmitted disease, and it's that T, the transmitted bit, that tells you that they are communicable. They're transmitted from one person to another, which means that they are communicable diseases. Now, we've got lots of good examples there in the comments. I haven't seen any incorrect examples, actually. You guys seem to know this quite well. So I've got a few examples for you to write down if you're making notes here. COVID-19, flu or influenza, common cold, measles, and AIDS would be some good examples to take on board. They're diseases that you can catch from someone else. Great, so let's stop with the examples of communicable diseases now, so no more comments on that. Reggie, pox with chickenpox or smallpox or cowpox, that kind of thing, is an X on the end, generally speaking. So, some examples of non-communicable diseases. I wonder if we can now start, let's start posting some examples of non-communicable diseases now. Elizabeth has gone for cancer. Yes, very good. That's a good example of something that you don't, generally speaking, catch from other people. Rashid's gone for diabetes. I wonder, Rashid, if you know, there are two different types of diabetes. I wonder if you know which one specifically we would consider to definitely be non-communicable rather than something that's inherited. Callum's gone for asthma. Good. Lung cancer. These are all good. These are all good ones. Polio, Rashid, is caused by a virus, I believe. So that would count as a communicable disease. Cardiovascular disease is definitely a good example there from Kirsty. Well done, Kirsty. Let me see which other examples I think are good here. Arthritis from Kian, definitely, that's very good. Heart disease. We've got a lot of inherited disorders here. We will at some point be doing a lesson on inherited disorders, things like sickle cell, type 1 diabetes, birth defects, those kinds of things. For the time being, though, we're going to talk about stuff that's caused mainly by your lifestyle when we're talking about non-communicable diseases. Cystic fibrosis. Kidney disease, certainly kidney disease, I think, is something that you can get from your lifestyle. Heart disease is a good one from Junaid. Okay, cool. So the ones that I've put down here on my examples will be type 2 diabetes. There are two different types of diabetes. One you inherit, it's an inherited disorder. That's type 1. And type 2 diabetes is caused by your lifestyle, caused by the situation that you find yourself in, or the situation that you make for yourself. The picture that I've got there for non-communicable diseases is a good example of someone who may very well develop type 2 diabetes. Eating bad food, not getting much exercise, those kind of things tend to lead to diabetes. That's a lesson for another time, and we will be talking about that in future lessons as well. Let's stop with the examples now in the comments. Thank you. You guys are doing incredibly well with posting these things, but let's stop that for now. Heart disease tends to be something that is a disease that you get not from catching it from somebody, but from your lifestyle. Arthritis is something that you don't catch from other people. It again comes sometimes from your lifestyle, so from maybe the type of work you're doing, that sort of thing. And cancer. Certain types of cancer are caused by the choices that you make, whether you decide to smoke, heighten your chance of getting lung cancer. Drinking can lead to liver cancer. Eating the wrong types of food can lead to bowel cancer, things like that. So different types of cancer, generally speaking, we would say were non-communicable. You get them from your lifestyle choices rather than from a bacteria or a virus. Silas has just had a very, very good question. Silas has put up the question, does clicking your knuckles lead to arthritis? And there is a very, very interesting study that was done on this. This is a nice little sidetrack just to take. Arthritis is where the cartilage in your joints wears down and your bones start to rub against each other, and it's not terribly nice. There was a study done by someone a few years ago. I'm just looking up his name. I'm not sure I can find his name, but there was a guy who spent 40 years cracking the knuckles only on one hand. So he only cracked the knuckles on his left hand in order to see. Oh yeah, Rashid is talking about it right here. In order to see whether he developed arthritis in that hand and didn't develop it in the other, and he found that there was no difference. So cracking his knuckles did not lead to arthritis in that one hand, which is quite an interesting study. You can get it from other things like using your joints a lot. So if you do a lot of manual work, you may well end up with arthritis later on. Okay, cool. So let's move on. So we talked at the start of the lesson about your health being to do with your physical and mental well-being. So what might contribute to poor health? I'll start you off. I'll give you one. We've got diet. There are two other things that I want to get in here. There's diet, and there's a couple of other things. What might the other two things be that might contribute to poor health? We've got diet. What else might we have? One of them was mentioned. Yes, you've got environment. That's good. Lifestyle. Good. Yeah, lifestyle is one of them. There was another one, a word beginning with S, that somebody mentioned earlier on in the lesson. Exercise or lack of exercise, I would say, would come under lifestyle or life situations. Stress, yeah. Mahira and Rashid, Juanita, Veer, Silas, all these people saying stress. So yeah, so the three main things that we need to consider that contribute to poor health would be this is to do with non-communicable diseases, generally speaking. There's diet, stress, and your life situation. So we'll talk about all three of those things to start off with. We'll go through each of them one at a time. So let's start off with diet. If you don't get enough to eat, or you don't get the right nutrients, it can lead to three things, and these are three things that you should probably be taking notes of if you're taking notes at home. Let's stop with the lists just for now. We're just talking about diet for now. We'll get on to life situations and lifestyle in just a second, which is what a lot of these things come that you're posting about. I'll talk about. But for now, if you don't get enough to eat or the right kind of nutrients, it can lead to starvation, which is a horrible thing to have happen. It can lead to something called anemia. Anemia is where you basically don't have enough red blood cells. You're not getting enough iron in your diet, and so you don't have enough red blood cells. Red blood cells are what carry the oxygen around your body. If you don't have enough red blood cells, then that causes problems with your respiration, causes problems with your ability to do anything, really. Yeah, and it's lack of iron, as Olamide has pointed out, that causes anemia. Rickets is another one. Rickets is caused by a lack of calcium in the diet. So that's again to do with the lack of nutrients. So starvation is when you don't have enough to eat. Anemia is a good example of when you don't have enough iron in your diet. You often get iron from eating meat. So beef, lamb, those kinds of meats contain a lot of iron. And rickets is caused by a lack of calcium. Calcium is found in dairy products, so milk and cheese and things like that. Anemia, I think it can be an inherited disorder, but generally speaking, Princess, it's caused by a lack of iron in the diet. And yeah, rickets is where your bones bend. So those two diagrams I've got on there show somebody's bones and they're sort of bending outwards, they're sort of bowing outwards, and then you end up with this sort of bow-legged looking thing where your legs are shaped literally like the bow from a bow and arrow. Yes, Faber's got another one in there as well. Scurvy. Faber, I wonder if you know what causes scurvy. Scurvy is it's to do with not having the right nutrients, but which nutrient is it that causes scurvy? Yeah, that's right. Hatim's got the answer there. Scurvy is caused by a lack of vitamin C. Now, Americans, people in the US, sometimes refer to people from Britain as limeys. They call us limeys. There was a great Terence Stamp film about 20 years ago called The Limey, about a British guy who goes over to the US. But limeys is the Americans' nickname for us British people. And the reason that they call us limeys is that back in the 17th or the 1700s and 1800s, our sailors used to, as well as their ration of grog that they got on board boats, would also be given limes and other citrus fruits to eat, because limes and citrus fruits contain a lot of vitamin C. Sailors used to get scurvy at sea a lot, and the British discovered that if you gave people citrus fruits, so things like limes, then they didn't get scurvy. So yeah, scurvy is a really good example of a disease that you contract by not having the right nutrients, in that particular case, vitamin C. Kian's got a good point here. Kian said, I swear cereals contain iron. And tomorrow morning when you eat your cereal, have a look at the box, because it will, generally speaking, say fortified with vitamins and iron. And Kian, you are correct, your cornflakes do contain iron. The corn itself, though, Kian, does not contain iron. So it's not that the corn being grown in the field has a lot of iron in it. They're literally grinding up to a powder a bunch of iron and putting it in with the cereal. So your cornflakes have powdered iron in them. And the reason is to prevent people from getting anemia, to make sure that people get the right kinds of nutrients. Another thing you can do, if you have a really strong magnet when you've got your cornflakes in your bowl of cereal tomorrow, you can actually chase a cornflake around the bowl with a strong magnet. Because of the amount of iron that a cornflake has in it, you can actually get it to move around a bowl of cereal with a strong magnet. So Kian, maybe you could try that tomorrow. Richard's actually just made that exact point. So yeah, well done, Richard. That's exactly right. Let's have a look through some of these other comments. Why does your stomach become bloated when you don't eat? Now that is a very good question. And it's not one that I know the answer to off the top of my head, so I'm just having a quick Google of it. So that swelling of the stomach that you can see in that poor child there on the left is caused by a lack of protein. So a lack of protein in the diet causes the stomach to swell. You end up with what's known as fluid retention. So there's a lot of excess water inside that poor kid's stomach there. So that's what causes that, Juanita. What else have we got? That's good. Okay, cool. Right. So not having enough to eat and not getting the right nutrients can cause all sorts of problems. Heartburn sinuses when you have too much acid in your stomach. So your stomach contains obviously acid to help break down your food. It's when it starts to come back up out of your stomach, or when you have too much of it, essentially, is what causes heartburn. So you need some Gaviscon, you need those firefighters to go down there and neutralize the acid. Why is it called heartburn? Really good question. Because the acid is coming up through the valve at the top of your stomach and actually back up into the esophagus. So it feels like it's happening where your heart is rather than where your stomach is. That's why it's known as heartburn. It comes up because there's just too much of it, or you've eaten a lot of food that contains a lot of acidy type stuff. Any other interesting sciencey type questions like that we can always do at the end of this lesson, but let's move on and have a look at this. If you eat too much of the wrong types of food, it can lead to various different things. It can lead to obesity. So obesity is where you've just got too much body fat, and that's caused by eating the wrong types of food, generally speaking. Some cancers can be caused by eating the wrong types of food. Bowel cancer, so that's cancer of the large intestine. That can be caused by eating too much of things like donuts and bacon and pizza, and basically all the stuff that's really nice is not, generally speaking, very good for you. It'd be wonderful if salad was the stuff that gave you cancer and pizza was the stuff that wasn't, but unfortunately that's not the way around. So eating the wrong types of food can give you certain types of cancer, and type 2 diabetes as well. So type 2 diabetes is to do with your body's ability to process sugar. If you give your body too much sugar all the time, your body at some point essentially gives up and says, well, I'm not going to bother doing this anymore. You can just have a whole bunch of sugar in your blood, and then you end up with something called hyperglycemia, which is very, very bad for you. Can cause all sorts of problems. So that's type 2 diabetes. It's caused by eating too much sugary food. So you can obviously be starvation and lack of nutrients can cause all sorts of problems, but so can eating too much food can cause problems for you there. So this is all to do with diet that we're talking about here. We will come on to other lifestyle factors as well, but at the moment we're just talking about diet. Gabrielis, there is some evidence to say that the preservation process used in bacon, which does, as you pointed out, contain nitrogen compounds, those can be carcinogenic, meaning that they can cause cancer. Cancer does not come from eating cancer, Harry. Cancer comes from eating certain types of food, which I got pictured for you there. Okay, cool. Right, so let's move on then. So we've talked a bit about diet. Let's have a look at this. So I've got a bit of a graph here for you. Hang on a minute. We've got a bit of a discussion going on in the comments here. I don't know where you got this idea that we can eat cancer. No, you can't eat cancer. You can develop cancer from eating certain types of food. Things like fast food and donuts and bacon can heighten your chances of getting certain types of cancer, like bowel cancer, so cancer of the lower intestine. But nobody's actually eating cancer. That's not what's going on there. So we've got a bit of a graph here on, and cancer is, generally speaking, not a communicable disease. That is correct. We've got a bit of a graph here. I want you to see if you can post in the comments for me. What do you reckon this graph is showing us? It's one of those graphs that's got two axes. It's got two y-axes. We've got on the left-hand y-axis, we've got the kilograms per individual of sugar being consumed. And on the right-hand side, we've got the prevalence of obesity, so the number of, or the percentage of people who are obese. I want you to tell me what you can discern from this graph. Hatton correctly said that the graph shows the relation between sugar intake and the prevalence of obesity. So what is that correlation? Yes, Hatton, you are completely correct. It does show the relationship between sugar intake and the prevalence of obesity, but what is the relationship? I wonder if people can see that. Fatima says that the increase in sugar consumption and obesity rate over the years. Okay, cool. So yes, so sugar is the amount of sugar consumed is going up over the years, and the number of people who are obese is going up over the years. Hatim again. Well done, Hatim. Has got a good answer here. Shows that as the sugar intake increases, the prevalence of obesity increases. That's really what we're looking for here. So Hatim, you've hit the nail on the head there. And looking through the comments, quite a few other people after you have then said the same thing, which is great. So as the amount of sugar that people eat has risen, the number of obese people has also increased. So there's some correlation there. There's a correlation between the amount of sugar being consumed and the percentage of people in the population who are obese. This is probably a pretty decent sign that eating too much sugar can cause you to become obese. So too much bad food, too much sugary food, things like donuts and all the good stuff, sweets, chocolate, that kind of thing, can lead to obesity. It can also lead to type 2 diabetes and even to some types of cancer. So it's really important that you do maintain a healthy diet. It's for your own good. You don't want to end up going out that way if you can help it. So yeah, you want to maintain a nice healthy diet if you can. Princess is saying some people eat a lot of sugar, but they will still be skinny. Princess, they may be eating a lot of sugar and they may be skinny right now, but maybe check up with them again in 5-10 years time, and you'll probably see something quite different. So stress. Let's talk about stress. Oh, hang on a minute. Let's just go back. We had a question from Ronnie. What was the second line showing? So yes, so there are two lines on this, Ronnie. We've got the line with the black dots, and the black dot shows the sugar consumption in kilograms per person, and the one with the white dots shows the percentage of people in the population who are obese. And you can see that we have obviously more data points for the amount of sugar being consumed than we do for the obesity prevalence, but you can see that as the amount of sugar being consumed goes up, the number of people who are obese also goes up. So that's what we're looking at there, Ronnie, is that correlation between those two things. Let's not get onto the subject of metabolism for now, guys. It's not really something that we need to be talking about right here. We can maybe talk about it after the lesson is finished, but for now, let's drop metabolism. We'll chat about it after the lesson. Okay, so stress is another thing that can cause ill health. It can cause ill health. It's a part of everyday life for everyone. Stress, unfortunately, is just one of those things that everybody really has to deal with over the course of their life, and there's some evidence that it's probably good. If you have no stress at all, then there's nothing really driving you forwards to improve your life. So a little bit of stress is sometimes a good thing, but too much stress can lead to health problems. So stress, well, Silas has just asked, what is stress? When we say stress, we mean problems that are thrown in your path, things that you have to do that are difficult, those kinds of things. Maybe someone else can say what might, in fact, this is probably quite a good opportunity. What kinds of things can cause you to have stress, to suffer stress? And we're talking about mental stress here. Yeah, worrying about the pandemic is a pretty stressful thing. That's good. Isha says too much homework. Oh dear, poor Isha. Exams. Okay, I think you guys have got a pretty good idea about what can cause stress. Peer pressure, which was the one that I think Junaid talked about at the start. Home problems, things you struggle with. Yeah, exactly. All of these things are the kind of things that cause us stress. And as I said, generally speaking, stress can be a good thing. A little bit of stress can help you to overcome a problem. It can help you to improve your life. If you have something that's bothering you, generally speaking, what you do is you go out and you try to sort it out. Which can make your life better. So a little bit of stress can be a good thing, but too much stress can lead to health problems. It can lead to heart disease. So looking at studies on this kind of thing, people who have a lot of stress tend to also have very high blood pressure. And having high blood pressure can in turn lead to things like stroke or heart attacks. Okay, let's stop with the examples of things that cause stress now. But yeah, that's pretty good. Hypertension, Favors just said there's another thing that can be a problem with your circulatory system. Certainly, hypertension, high blood pressure, that kind of thing. So Jaden has just asked the question: what does high blood pressure mean? That's quite a good question. So your blood in your veins and your arteries is under pressure. So in order to get it to go around your body, your heart is pumping, and that applies some pressure to the blood. Hypertension, incidentally, is the same thing as high blood pressure. So your blood is under a certain amount of pressure in order to get it to move around your body. When you are stressed, though, often your blood pressure will increase, and that can then cause, when the blood then gets up to your brain, for instance, it can burst out of the blood vessels if it's under too much pressure, and that's one of the things that causes stroke. Stroke is caused by that kind of thing. A heart attack, if your heart is under too much pressure as well, that can cause the heart to stop beating. So yeah, hypertension, which is another word for high blood pressure, that's what we're talking about there. We're talking about the blood itself being under a lot of pressure. And of course, stress can lead to all sorts of mental health problems, and depression and frustration, headaches, and all sorts of things like that. There's some examples there on the board for you for the kinds of mental health problems that can arise from excess stress. So we talked about diet, we've talked about stress. The other thing we need to talk about then is life situations. So we'll come on to that in just a second. How does stress occur? And so I'm just reading some of the questions we've got here. Ahmed says, how does stress occur and which place in the body is hit with it first? Well, stress is really a mental thing, Ahmed. It's your brain worrying about stuff, I suppose, is the way to look at it like that. But then it can then have a physical impact on your body in the ways that we've discussed, often to do with high blood pressure and other things like that. It can also have a negative effect on your mental health. Silas says, how is mental health treated? Well, it can be treated chemically, so it can be treated with pills and so on, or it can be treated with therapy. So maybe you'll go and speak to a counsellor or a therapist, or maybe your therapy will be, doing some baking or playing some video games, those kind of things. Relaxing, reading a book. Mental health can be treated in all sorts of different ways, Silas. How do strokes happen? Well, strokes often happen, Timmy, with high blood pressure causing a blood vessel to burst in your brain, causing damage to part of your brain, which is essentially what a stroke is. Does sickle cell change the pressure? Not that I know about on the media. I don't think having sickle cell anemia causes a different type of blood pressure. Jaden says, do drugs increase or decrease blood pressure? Well, there are different drugs that will do different things. Some types of drugs, I believe they are called beta blockers, I think, will decrease your blood pressure, but other types of drug will increase your blood pressure. So it entirely depends on the type of drugs that you're on about. Sleep deprivation can certainly lead to mental health problems. Yes, Leanne. Just seeing what else have we got here. Thank you, Silas. Very kind. Okay, so let's move on. So here is another graph for you, and I want you to have a look at it. We've got depression on the y-axis. So this is surveys of people. Basically, each cross on this graph is a person who's been asked to describe the level of stress they're under and the level of depression that they feel. And I want you to try and describe the relationship between people's idea of how stressed they are versus how depressed they are. And is there any correlation between the two? We'll talk about sickle cell after the lesson. And also asylums, if we really want to, we can talk about that after the lesson. But let's concentrate on where we are right now. So we've got people talking about positive correlation. The more stress you have, the more likely you are to be depressed. That is a very good answer there from Favor. As stress score increases, depression score increases, says Ronnie. Again, very good. More stress, more depressed, says Alia. That's good. Yeah, so good. Right, so we've got a good idea. You guys are obviously very good at reading graphs. That is wonderful to see. So yeah, there is indeed a positive correlation between the levels of stress and depression. Or to put it another way, the more stressed you are, the more likely you are to be depressed. Now, a certain level of stress, as I said, is a good thing, to be honest. It helps to push you forwards, helps you to move forward with your life. But the more stressed you are, the more likely you are to suffer from depression, to suffer from poor mental health and other things like that. Right, life situations, let's talk about that. I don't know how clearly you can see this graph, but each one of these circles represents a country. The bigger the circle, the bigger the country. On the left-hand side, so on the y-axis, we've got life expectancy, so how old you can expect to be when you die if you are from that particular country. And on the x-axis, we've got the average income per person, so how much money a person makes on average in that country. And the question here is, what does this graph show us about the relationship between an average income and how long you can expect to live? And again, you should hopefully be able to find something nice and obvious there. Let's have a look at it, see what you can tell me. If you've got any outliers, if there's anything you think looks like an interesting data point in there, maybe you could point out something that looks like an anomalous result. Okay, so we've got some good stuff in here. Yeah, people are finding individual countries. I said Nigeria is somewhere near the bottom. I think that's probably about right. Where is the UK? The UK is quite small, but it's up towards the top right. It's one of these blue circles just to the top left of that purple USA. That's where the UK is. Less income, this is from Mohammed Udin. Less income often leads to lower life expectancy. That is true. Ronnie says the higher the income, the more money that can be used for healthcare, and so higher life expectancy. Ronnie, that is an excellent answer. And the reason why that's an excellent answer is that you've spotted the correlation. You've spotted there's a positive correlation between life expectancy and income, but you've actually also gone on to try and explain why this might be. And your explanation is very good. Ronnie has correctly pointed out that the higher the income, the higher the life expectancy. But he's also pointed out that the more money people have, generally speaking, the better the healthcare service will be in their country. So the UK, we are very rich compared to the rest of the world. We have a very good healthcare service. The NHS is excellent. And so our life expectancy is great because we are able to put a lot of money into healthcare. A country like, if you look right down at the bottom left, that one right down at the bottom left there is the Democratic Republic of Congo. They have very, very low income per person, less than $500 per year, and they have a life expectancy of less than 50 years. So not very much money, not much money for healthcare, so they don't tend to live as long, which is very sad. I wonder if anybody's able to tell me in the comments what the color coding might be on this graph. The countries are coded in particular colors according to something. What is it? Yeah, according Via, Isha, Gabrielis, Ronnie, and so on have pointed out it's per continent. So where the country is in the world, which continent it's on, corresponds to different countries. So orange is the colour that's been used for Africa, blue is the colour that's been used for Europe, and green is the colour that's been used for Asia. Now, this isn't a comment on how fair this is at all, but you can certainly see that income for people in the continent of Africa is very low, and life expectancy, generally speaking, consequently, is very low. Whereas in Europe, where we're from, life expectancy tends to be high, and average income also tends to be high. So that's quite interesting. The USA, another thing that's quite interesting to point out about this graph, the USA up there at the top right is that big purple spot up there at the top right. Pretty much all the other countries at its income level are above it in terms of life expectancy. So Japan, for instance, which is that big green spot up at the top there, lower income per person, but much higher life expectancy. The UK, lower income per person, but a higher life expectancy. And that is coming back to what Ronnie was talking about, is to do with the way that the healthcare is structured in those countries. The USA, their healthcare system is a lot more expensive because of the way they structure it, and consequently life expectancy is quite a bit lower. Um, okay, Silas, you've got some problems with your laptop. Let's see if you can sort it out, but let's try not to disrupt the comment section here. Gabrielis has pointed out in the USA, many people can't afford to pay for insulin, scans, or even ambulances. Yeah, that's correct. In the US, people do have to pay for those things out of their income, or they have to have health insurance. Whereas over here, we have the NHS, which is the term is free at the point of use. So it's taken out of taxation, so that if you have to go into hospital, you don't end up with a bill at the end of it. Probably a better system. Olamides points out, yes, Africa has slower development, generally speaking. No, the US does not have free healthcare. Okay, right. So let's move on. So your income, as we've pointed out, is linked to your health. The more income you have on average in a country, but also the more income you have personally, generally speaking, the healthier you are and the healthier you will be able to stay. So in the UK, we're relatively rich. We are amongst the richest countries in the world. And so we are lucky enough to have the NHS. What other types of life situation, though? What other types of things about your life might affect how healthy you are? Let's see if we can get some ideas posted in the comments. What other types of things might affect your life expectancy or how healthy you might be over the course of your life? Poverty from Juanita, yeah, that's to do with your income, definitely. Pollution, that's a good one from Ronnie. Yep, the more pollution you're subjected to, the less healthy you will be. Yes, Easter, I suppose. Wars, that can make a difference. The area you live in, says Aaliyah, that is a very, very good answer. Where you live can certainly determine how healthy you are. Activities you participate in, good. Let's see, what else have we got that's good in here? Hatim talks about the quality of healthcare. Quality of healthcare can make a really big difference, definitely. Your ethnic group, yes, Fear, you are correct. Your ethnic group can make a big difference. Harry's talking about, well, I think he means sedentary lifestyles. So lifestyles where you are not walking around very much, where you're just sitting down a lot. That is good. How many children, Veer? Yes, how many children you have makes a big difference. That is true, especially to women rather than men. But yeah, that is true. Financial status, your gender, Veer says as well. Good. Okay, so yeah, so the kinds of things that we need to know about here are these: where you live, absolutely. Where you live can determine quite a lot about how healthy you will be. If you're living somewhere that's very poor or somewhere with poor healthcare, you're going to end up less healthy than people who don't live there. Your gender makes a big difference, whether you are whether you're male, whether you're female, whatever you might want to be. That can make a big difference. Your ethnic group can make a big difference. Certain illnesses, certain diseases are more prevalent in certain ethnic groups than others. Your access to healthcare, so whether or not you can just hop in an ambulance and go down to A&E and get yourself patched up, or whether you have to pay a lot of money to do that, or whether that services doesn't exist full stop, makes a big difference. The number of children you have, especially as a woman, every time you give birth, it's a risk. You're putting yourself at risk of all sorts of problems or complications or even death. And especially in places where you don't have very good healthcare, the number of children you have can really make a big difference to do with your life expectancy. The environment you find yourself in, the local sewage and waste disposal. So over here in the UK, we have bin collections weekly, or every other week perhaps. In some places, or we also have running water. When you go to the toilet, you can flush the toilet and everything goes away. You can just forget about it. In some places, there is not only no decent waste disposal, but maybe you're actually going to be living on a rubbish dump. this is the case for millions of people. You won't have any kind of running water, any kind of sanitation when there is no toilet to flush. So your poo and your wee has to go somewhere, and it can end up getting into your food essentially, which doesn't mean that you end up very healthy. And drug use as well. If you're using illegal drugs, that can potentially cause health problems, but also prescription drugs in the wrong doses can cause all sorts of problems with your health. Noise exposure, yeah, I suppose noise exposure here that can make a difference. Just having a look at some of these other comments. Yeah, I mean, that Silas is pointing out, what about exposure to radiation center jobs? I mean, that is a pretty niche case. I would say, Silas, most people are not exposed to radiation, but yeah, you can be exposed to certain things in your jobs that could impact on your health, certainly. And yeah, addiction on the media to drugs, whether legal or illegal. Okay. Right, okay, let's move on then. So factors like where you live and your gender can interact. Now, this is the bit where it starts to become quite interesting. We've talked about all the different things that can affect your health, your diet, the amount of stress you're under, the life situation you might find yourself in. We talked about the different types of diseases, communicable and non-communicable diseases. I want to try and get now to a point where we can talk about how these things interact, how these things work together, because this is actually something that is important to us now in the situation that we find ourselves in lockdown. This is one of the reasons why we're in lockdown, is this next bit of the lesson. So factors like where you live and your gender can interact to produce different results. So let's have a look at this little picture we've got here. In the Netherlands, the life expectancy, if you're a man, is 79.9 years. The life expectancy for a woman is 83.2. Now this gap that we see is generally the same around the world. Men don't have as high a life expectancy as women. Now, in the EU as a whole, so across the whole of the European Union, the life expectancy of a woman is 77.9 and for a man is 83.3. But the interesting thing here is how different it is in the different countries in which you live. So in the Netherlands, as a woman, you might live to 79.9, whereas in Lithuania, you might only live to 69.2 years old. In the Netherlands, as a man, you might live to 83.2 years old, but in Lithuania, 79.7 as a woman there. I think I might have said that the wrong way around, but yeah, you get the idea there. So not only your gender, but also where you live can interact to change your health, to change your life expectancy. In this case, we've got the fact that women tend to live longer. That is the case. We've also got, interacting with that, we've got where you live coming in to modify the life expectancy that you might have. Why do females live longer? Junaid, what do you think? Do they maybe they have fewer health problems, generally speaking, so end up living longer? There are all sorts of reasons why a woman might live longer than a man. But yeah, it might also be to do with, Nigel's pointed out, men often are killed more often. I think that might be, again, a bit of a niche case there, Nigel. The murder rate and rate of people dying in wars in a country like the Netherlands, for instance, is not particularly high. So I don't know whether that will really come into it. But Veer's got a good point. Men are probably more likely to do things like smoke and drink heavily, and that will impact on their life expectancy. Okay, so here's the data for the UK then. Let's have a look at this graph. The red line here represents over the course of the years since the start of the 80s until basically now. Life expectancy is going up. This is a good thing. We are living longer, generally speaking. So back in 1981, as a woman in the UK, you might have expected to live till you were 77 years old. But right now, you might expect to live to maybe 83 years old. So you've got an extra 6 years in the bag. Fantastic. Now, as a man, back in 1981, you probably would have expected to live to about 71 years old, but right now, closer to 79, 80 years old. That sort of thing. So life expectancy is increasing. But why might life expectancy be increasing? Why might we be seeing that how long you live is getting longer? Why might that be? Answer in the comments. Got some good answers coming in here. Olamide says the evolution of technology. I wonder, Olamide, if you could tell us a bit more about that. The evolution of what type of technology in particular? Favour says better healthcare. Very good, yeah. Healthcare is improving. Living conditions are improving, Mohammed said. Veers pointed out, or Veers described the graph, but I want to try and get some explanation to the graph here, Veer, about why these lines might be going up. Hatton says better quality of healthcare and hygiene. Good, very good. Better medicine, says Alia, also very good. The technology that was being talked about earlier on, Richard saying better medical technology, that's good. Better quality of food, income's going up. Favour, why might income increasing be something that would cause you to live longer, I wonder? Aisha Khalil has said back then more people used to smoke. That's also true. Fewer people smoke these days, meaning that life expectancy is increasing because fewer people are taken from us for developing lung cancer. More health technology, healthcare is improving. Guys, you've got some good answers here. Vaccines as well. Yeah, we're getting some better vaccines to vaccinate against illnesses. The BCG, which you guys probably have in either your right or your left arm, you probably had it when you were a baby. I think my year at school was the first year to get the BCG. I had my BCG when I was 14 or 15, I think. So that would have been about 1998 or 1999. But that's a vaccine that came in during the time period that this graph is showing. So yeah, vaccines do definitely help with that kind of thing. Okay, cool. So yeah, so people are eating better. Why might life expectancy be rising? Well, people are eating better, as has been mentioned. Healthcare is improving. The technology that we use for healthcare and the techniques that we use for healthcare, the medicine that we use in healthcare are all improving. Waste disposal and pollution are getting better, or pollution is decreasing. And we're having fewer children as well. So generally speaking, as we go up, as time passes, the number of children per family tends to drop. Which is interesting. So let's talk about these this sort of stacking up of health problems, things that cause problems with your health. So being obese obviously can make you more likely to get a disease. We've talked about that already. Having a high level of stress can also make you more likely to get a disease. Now, these two things can stack up. They can act like multipliers. They can act like damage multipliers, essentially. If you're obese and you also have high levels of stress, you're much more likely to get some kind of disease or some kind of health condition. So having more than one condition can stack up against you. So one of the reasons why we're in the lockdown that we're currently in is because we want to try and help protect vulnerable people. So there are lots of people out there who have pre-existing conditions, people who are obese, people who have high levels of stress, but people also who have cancer, people who are HIV positive, that sort of thing. And so if those people then also contract the coronavirus, if they also get the coronavirus, that will be another thing, and that will act a bit like a multiplier. So they'll be obese and they'll have type 2 diabetes or whatever, and then they'll also get the coronavirus. That will make them then much more likely to get the disease COVID-19, which will then cause them potentially to die. So the reason why we're in lockdown at the moment is simply because of the way that health problems can interact. So why do we need to protect people who already have poor health in our lockdown? I wonder if you can tell me why that is. why might we need to protect people who already have poor health by doing the lockdown that we're doing at the moment? Hatem said people with more poor health and underlying health conditions are more vulnerable. Yeah, we don't want them to die. Why might they potentially die, though? Hatem says they're more likely to die. That is true, but that's good. Okay. So having pre-existing conditions makes you more vulnerable. Exactly. Makes you more vulnerable and increases your chances of developing the disease, COVID-19, in a nasty way, in a way that could potentially kill you. They might have a weaker immune system. Their immune system may well be fine, Jaden, to be honest, but it's the stacking up of these things causing their body to be weaker. The more pre-existing conditions you have, the more they act like multipliers, essentially, increasing your chances of developing COVID-19. Yeah. Right, so this is the last slide in our lesson, and then we can move on to any questions that you might have. One area pupils often struggle with at GCSE, and we see this time and time again, they're often quite good with their knowledge, you're quite good at recalling stuff, facts and figures and so on. But when it comes to actually applying your knowledge, so applying and cause problems. So this last question is designed to try and help you bolster that skill, that ability to apply the knowledge that you've learned. It will also help you understand whether you've actually taken on board anything I've been saying over the course of the last hour or so. So the question is simply this: can you explain to me what is going on in this graph? If you've got an idea, please post it in the comments. Okay, so we've got some ideas coming in. A good question from Silas. I maybe should have told about this before. What is HIV positive or negative? HIV positive means that you have the virus that can cause you to get AIDS. HIV negative means that you don't have the virus that can cause you to be to get AIDS. So most people would find themselves being HIV negative. Some people have that virus which can potentially cause them to contract AIDS. Issa says the graph is saying that if you use drugs, you're more likely to contract HIV. That's actually not what it's saying. Have a look at what is on the y-axis there. Maybe you can't read it. What it says is the numbers infected with TB, so tuberculosis, per 100 years, basically. So it's not to do with the fact that injecting drugs increases your risk of getting HIV. I think Faber might be coming onto the right idea here. So what Faber's written is the drug that injects HIV positive leads to higher chance of tuberculosis. So I think that's a slightly awkward sentence there, but I think what Faber might be trying to say is that if you inject drugs and you're HIV positive, you have a much higher chance of getting tuberculosis. We've got Angel here saying people with non-drug injecting HIV, that's not that. No, sorry guys, I'm just reading through your comments here. Olivia has said more people who are injected and have HIV positive are more likely to get TB. That I think is the closest one we've got so far. So Olivia says more people who are injecting drugs and who are HIV positive are more likely to get TB. I wonder if we can explain what is going on with that, Olivia. Jaden says if you do drugs and you're HIV positive, you have a higher chance of getting tuberculosis. Very good. Why might that be? So, there are 4 columns here. The first bar is showing the number of people who get TB who don't inject drugs and don't have HIV. The second bar is people who don't inject drugs but are HIV positive, and they have a certain chance of getting TB as well. The third bar is people who do inject drugs but don't have HIV. And that fourth bar is the people who inject drugs and are also HIV positive. What is their chance of getting TB? So Hatim's latest comment says people who tested HIV positive and inject drugs are more likely to have TB. This is due to the fact that HIV weakens your immune system and TB is able to develop within their body. That's certainly part of it. Now, nobody yet has included the word multiplier in their answer, as far as I can see. I wonder if we can get that word multiplier in there. Angel, it needs to come in a full sentence. Give you 30 more seconds, guys. Okay. Right, okay, so let me see if I can explain this graph to you then. So the first column, that first column there, the non-drug injecting HIV negative. So people who don't inject drugs and don't have HIV, that bar is very, very small. They have a very low chance of developing tuberculosis because they don't essentially have any pre-existing conditions. They're not a vulnerable person. Now, maybe you don't inject drugs, but are HIV positive. You do have the virus which causes AIDS. Now that does, as you can see, increase your chance of getting TB, but not by much, not by a whole lot. It's that yellow bar, that's that second bar there. So having HIV does increase your chance of getting TB, but not really by very much at all. If you inject drugs, but you're HIV negative, so you don't have the HIV virus, the human immunodeficiency virus, then you have an increased chance of getting TB, but not, again, by very much. So if you don't inject drugs and you don't have HIV, you don't have much of a chance of getting TB. If you don't inject drugs, but you do have HIV, you don't really have much of a chance of getting TB either. If you do inject drugs, but you don't have HIV, you've got a little bit of a chance of getting TB, but it's not very big. Now, it's when we have somebody who injects drugs, but is also HIV positive, that suddenly we have a much, much bigger chance of contracting TB. And it comes back to what we were talking about earlier on. If I come back to here, is these multipliers. You can imagine you've got someone, well, in this particular case, you've got someone who's obese and has high stress levels. In the example I just gave you, you've got someone who's HIV positive and injects drugs. So they have 2 different things going on, and those health problems stack up and act like multipliers. And their chance of getting a particular illness, in the case of the example I gave, is increased substantially. So there's a big increase in the chance that they're going to then contract something else. And that's why we're doing this lockdown. That's why we are where we are, is because we have people who have a very high chance of getting the disease and suffering very badly from it. So by staying put and not spreading that disease, we reduce their chance of dying. And that's it.